All right. Welcome, everybody. It is 2:02, so we're going to go ahead and get started. My name is Maria Waters. My pronouns are she and her, and I have the honor of serving as the Faith-Based Partnerships and Community Liaison for the Oregon Department of Human Services. I also want to introduce my colleague, Stephanie Stevens, who's here. Stephanie, do you want to introduce yourself?
Yeah, hi everyone. My name is Stephanie Stevens. I also use she, her pronouns, and I'm part of the Mighty community engagement team here at ODHS. Excited to be here. Back to you.
Great. We are so excited to have all of you join us here today. A couple of housekeeping reminders. As you can see, we do have ASL interpretation available, and we also have closed captioning. If you would like to use closed captioning, there is a button at the bottom of your screen that says CC, and you can access that service there. Also, you can see messages from our team in the chat feature, as well as a link to where the recording will be posted after this meeting. But we really want to hear from you as much as possible during this session using the Q&A feature. So also at the bottom of your screen, you should see a Q&A button. And as we go through the content today, we would love for you to just start dropping your questions in that area. And at the end of our time together, we're going to go ahead and answer as many of those as is possible during our short 1 hour time today. But we just want to, again, welcome you. This is happening as a direct result of our January gathering, where some of you gathered together in Portland at our East Branch, I believe it was, and some of you gathered with us virtually online for really what was our first community engagement session with our ODHS leadership team. And you can see we have Director Fairbours here with us again today, as well as several other executive leaders from our ODHS team, really as a continued commitment to strengthen our relationships with each of you, to continue to get to know each other, be more transparent about what's happening in the agency and how we can work together collectively to achieve shared goals. And this is the first of some really exciting things that we have in store. Again, because of what you shared with us about wanting to be more transparent, be with you in person more. So we'll be sharing some of that today through our speakers. So with that, Stephanie, am I forgetting anything else before we turn it over to Director Fairbours?
Yeah, well, we just know there have been a lot of changes this year with our budget process, the way that we are creating our budget, the way we're working with our governor. So we wanted to give you a little bit of a briefing on that. It's not as interactive a session as we'd like, but again, teasing up what's coming later, we will have some opportunities later on. And so, yeah, I think at this point, we'll turn it over to our fabulous ODHS director. Fairbours, would you like to take it away?
Thank you, Maria and Stephanie. Good afternoon, everyone. It is great to be with you all. Thank you so much for joining us. I know you have many other things that you could be doing instead of spending your time this hour with us, but we appreciate that. Let's go to the next slide, please. What we want to share with you today is just very briefly review our vision and our Equity North Star. Talk about the themes from the January meeting that Maria talked about that occurred in Portland in our Gleason building. Talk about our 2025-27 budget process, our agency request budget, give you an update on where we are with that. Talk about opportunities for engagement for the community so that we can have the benefit of your insight and guidance and wisdom as we build our budget process and our legislative concepts, and finally, an opportunity for questions and your insight. Let's go to the next slide, please. You've seen this vision before. It's always good to remind ourselves and you as to what we're focused on. All who live in Oregon, regardless of race, identity, age, disability, or place, have the needed supports to achieve whole well-being for ourselves, our families, and our communities. Next slide, please. This is the slide around our Equity North Star. Again, you can see that it is based on 4 pillars: inclusivity, equity, service, and well-being. And all of those pillars are important. And if the vision that I just read to you really aligns well with that well-being vision. If we can be inclusive as an agency, if we can model equity, if we are in service to the Oregonians that we serve, which are about 1 in 3 people in Oregon, we can then begin to move toward that vision of whole well-being for ourselves, for our families, and for our communities. Let's go to the next slide, please. And with this slide, I'm going to turn it over to Seth Lyon, our Chief Operating Officer, to talk to you about some of the themes that emerged from our January partner meeting in Portland and some of the next steps about how we plan to engage with the community.
Thank you so much, Fariborz. I hope everybody can hear me well. Again, Seth Lyon, he, pronouns. I'm the Chief Operating Officer for Oregon Department of Human Services. I did have the pleasure to attend in person the gathering of almost 300 of you, valued community partners. It was really great to be in space, and I know we're back to virtual for this meeting, but we'll talk about in-person meetings to come. I just want to hit some of the themes that we heard in that conversation, just so we can keep that conversation going. Not that, you know, these are the only themes we'll talk about. I imagine as we continue, we'll have lots of back and forth in terms of what's possible. So I want to start with upper left of that slide and give a few points. Workforce development was a key theme that we heard about. And that starts with, you know, working together to hire and retain qualified providers, especially in rural areas. So that's where we're working with folks in the developmental disability and you know, different kinds of care, home care workers to support folks, and as well as those who we contract with. And you know, we're always working towards more equitable and efficient hiring processes. We want to diversify our staff and provide opportunity, but also work together to provide pathways for marginalized communities to access employment with us, as well as a livable wage job in the community. And so we want to continue to partner on that. It's a very important value for us. So we're very thankful to hear about that. I'm going to move to self-sufficiency programs and the Oregon Eligibility Partnership. You know, I think economic security came across as a strong theme that we want to partner on, and you know, concepts came up like, what if we had a food for all of Oregonians idea? You know, direct cash assistance is something we've been able to pilot with youth, but definitely a best practice we want to continue to work together on. Improved access to childcare. We just did move our employment-related daycare program to a new state agency, Department of Early Learning and Care, back on July 1st, so almost a year into that. But we have a strong partnership there to work. We do the eligibility for that program while they do the policy. And then just increasing the speed and coordination of access to benefits, which is always something that's really, really high on the list and a challenge. Moving to services to individuals with developmental disabilities, you know, specifically called out with services to those with brain injuries, and also just highlighting the needs of individuals with disabilities to policy and program decision makers. So how do we center those voices? And then increasing services and access for those who are deaf and hard of hearing. So those were some of the things that came up, and we really want to continue that conversation. We'll move around to, let's see, expanding in-home services. Really talking about, we had a strong theme around contracting in general and procurement and how we relate to each other financially, and the ability to expand opportunity to more agencies, and then also expanding the opportunity to get folks to do in-home care, as I talked about. Let's see, let's talk about supporting foster children for a minute. That's, something we're always working on. And, some great themes came out around increasing graduation rates and housing access for children that are in our care, as well as increased coordination with schools, and then the issue that we're always working on, which is access to care for youth with more complex needs. And I want to go back to community engagement for a minute, because that's why we're here today, and we do have a couple of documents also that I believe are attached to the appointment, a question and answer where we dug in and answered some of the questions that came from the last meeting. And then also another document about some of the themes that emerged, so that you can continue to see the reflection back, especially if you were not able to be at the last meeting, to continue to tee up those spaces. And then, the stronger messages we heard that were around community engagement, around to continue to stay in touch. And so we have this meeting, but we're also planning on, I believe, 9 community visits coming up across the state, and certainly looking at services and our access to these conversations outside of the I-5 corridor, in addition to the more populated areas. So those are the couple things that you can look for from us coming up soon. And I just want to also emphasize that we want to keep these conversations with our agency, different leaders within the agency to help us innovate, help us evolve program delivery, meet community needs, and align resources. So we will be providing more information about what our visits are going to look like in the next set of conversations. And I'll turn it back to Fairworth to talk a little bit about the budget process.
Thank you, Seth. What you see on this slide is basically what we have heard from our previous engagement, from what you have shared with us. In fact, I just noticed something in the chat which aligns with that first bullet. The access challenges that rural Oregonians experience outside of the major population areas, or particularly outside the I-5 corridor. And the need for more opportunities for community and faith-based organizations and leaders to connect with each other, and with ODHS leadership, we're trying to do a better job on that front. And one of the things that we're going to be doing, myself, our leadership in this agency will be visiting the various areas in Oregon, various districts, rural Oregon, to make sure that we're getting your feedback, we're getting your ideas as we move forward with this budget process. Next slide, please. So now we want to just basically go over the agency request budget and explain the process and how it might have changed. Next slide, please. Many of you remember that shortly after our current governor assumed office, and that was about now a year and a half ago, she introduced a new approach to developing Oregon's biennial budget. Some of you remember that in the past, that budget was generated first by state agencies putting their agency recommended budget together and turning it over to Department of Administrative Services, to Chief Financial Office. And then that would be vetted with that office, presented to the governor. The governor would use that information, her own priorities, and would introduce her recommended budget. The process has changed completely. It begins now with us collaborating early on, without developing anything, with Department of Administrative Services, Chief Financial Office, with the governor's office. Actually, it's a much more streamlined and efficient process because duplication is eliminated. We know right up front what's expected of us. We don't spend a whole lot of time on developing concepts that are not going to be moving forward. So from my perspective, it's actually a much improved process. It involves very close collaboration with not only Department of Administrative Services, but also other state agencies as we begin to build our budget for 25-27. Through the middle of this month, June, our Chief Financial Officer, Rob Quadieri, our Deputy Director, Lisa Wendt, our Government Relations Director, who you will meet here shortly, Roberto Gutierrez, have been leading this process for our agency with a large number of staff from program areas, our program directors involved. And they're continuing to work with the governor's office and with Department of Administrative Services to shape our budget proposals. And then what will follow, as I just shared with you, is engagement with partners, with the communities to get input around our policy option packages, legislative concepts, etc. Community partner meetings are in the process of being scheduled. It will take place in July and August. And that process will finalize our agency request budget, which is then due on September 1. 2 months ago, at the end of April, we submitted to the governor's office a preliminary set of policy option packages for 25-27. Keep in mind that it's still early on in the governor's new budget process, and we expect that the proposed POPs, policy option packages, will continue to be refined over the coming weeks, and they can be informed by past partner input. Again, as an example, the meeting that we had in Portland early on this year, and will follow closely Governor Kotek's direction to focus the agency budget requests on 5 specific areas. First is advancing the governor's housing and behavioral health priorities. We know that that's top of the line for her. Second is advancing racial justice and equity. She has identified that as a major initiative and priority for her. Improving customer service, and that is a directive to all Oregon state agencies to really focus on the customer. Fourth is strengthening existing programs instead of adding new ones, basically focusing on core work. And then finally, increasing efficiency in program delivery to better serve Oregon's cost-burdened individuals and families. Next slide, please. Earlier this spring, Oregon state economists projected a relatively balanced budget for 25-27, where expected revenue increases would cover the increased costs of maintaining current programs, and the new investments and proposals would be reserved for advancing the governor's housing, behavioral health, and education initiatives. What this means is most of ODHS policy option packages must stay within the 1% growth limit that has been identified for larger state agencies. That basically equals about $60 million, which is not a whole lot of money in our budget. When you look at our general fund budget, we're talking just over $6 billion. So 60 million is a very small investment. And many of our programs by themselves are several times the size of that allocation, but that's what we have to work with. We need to stay within that. Now, granted, I'll also make this clarification that those options, those policy option packages that align with the governor priorities are not included in the 1%. So we do have some possibility there. When the chief financial officer talked about, when our state economies talked about balanced budget that includes a substantial allowance for governor's strategic priorities, and then what's remain from whatever capacity that remains really should be focused on core programs. That is the direction that we have received from the governor. She really wants us to improve on how we're doing the services that we're providing. Next slide, please. Our guiding principles in developing our policy option packages are the direction that the governor has provided for budget development. Again, you all have seen these: advancing housing and behavioral health priorities, advancing racial and justice equity. I just shared those with you, improving customer service, strengthening key programs instead of adding new ones. And the other thing that she has directed all state agencies to do is to look for operational efficiencies, identify non-value added processes, eliminate those, because all of us are looking for capacity. And we know that we're not going to be getting additional staff. We are entering a fiscal environment in this next biennium that's not going to be anything like the last biennium when we had all of that federal money flowing into Oregon. So we have to be very cognizant of how we manage our resources. Next slide, please. So key priority areas for the budget requests are, as you can see on this slide, addressing and preventing youth homelessness. That's a major issue for youth that are transitioning into adulthood. Improving customer experience, again, the governor's focus on customer service and customer focus. Stabilizing provider capacity. Several of our programs rely heavily on providers. In developmental disabilities, almost all of those services are provided by providers, whether in-home providers, out-of-home providers, etc. So maintaining that capacity, we worked really hard during COVID to try to do what we could to keep our provider system from collapsing. And that support needs to continue because we all know what has happened with inflation, with wages, and doing the work of human services, doing the work of healthcare is a really difficult job. And in this environment and this economy, it's really hard to recruit and retain people. We understand that about our providers, and we'll do everything that we can to help with that. Modernizing systems and creating workload models. We still have systems that are 40 and 50 years old. And in order to really transition to the new environment, new technology, nowadays we're talking about Gen AI, generative AI, which is decades ahead of some of the systems that we have in place, some of the software that we're still operating on. So modernization becomes a priority for all of the state government, but also for Oregon Department of Human Services and Oregon Health Authority that share systems and software. Workload models, meaning basically creating a verifiable and accurate model that says, if you have this much work, what is the workforce that's required to do that work? We have some of that in place. We are putting more of that in place towards seeking help from contractors to help us get there. It's really important to know how many staff we need in what areas and adjust those based on caseload, based on workload. And finally, ensuring compliance with federal requirements. There are new requirements that are coming out regularly. We need to make sure that we are complying with those because if we don't, we run the risk of losing federal funding, which is a large portion of our agency's budget. So that's what's ahead of us. And with that, I'll turn it over to Roberto Gutierrez, the Director of our Government Relations, that is going to take you through the legislative process and the budget process.
Thank you, Fariborz. Good afternoon, everyone. Just before, as I kind of highlight a little bit about some of our internal process around the agency recommended budget, our ARB process, just this slide here is just a little contact information in terms of connecting people to your state legislators as people continue to make the rounds and contacts with decision makers across the state and engage on policy discussion, and in particular policy discussion that may impact the Department of Human Services. Next slide, please. Just a little bit about our overall process right now. Currently, we are in the process of developing our agency recommended budget to basically sort of, in terms of just spending, in terms of new investments, ideas for the following biennium through June 30th, 2027. Right now, we are trying to finalize our agency recommended budget. We'll continue to refine ideas. We'll continue to refine pricing at the request of the governor's office through of the month of August and post the agency recommended budget online September 1st. The governor's budget will be released at some point in December. Traditionally, it's released around right around December 1st, and we will begin session next year. The overall, I think, point to highlight in this overall process, there's some newness in this process. There is definitely questions that might not necessarily be answered today, especially through this conversation. But if there's particular ideas that people are trying to advance as it relates to the agency with recommended budget or just any impact to the Department of Human Services, I encourage communication to the governor's office. I encourage communication with specific legislative members. I encourage conversation with some of different groups like the Racial Justice Council or the Interagency Council on Homelessness, for example. We can go to the next slide, please, Andrew. Because conversations, I would say, are focused currently on current service level, and conversations are focused on governor office priorities, agency recommended ideas to help continue the work of this agency. If there are particular opportunities where people would like to engage in this agency about independent ideas for consideration before the legislature next year, there's some specific points I think it's important to help to engage here at the department, and one of those things is around policy direction in terms of technical assistance. And I think what's helpful is when it comes to particular bills and we go through bills, is really trying to identify the intent of particular bills, so that way we can clarify that intent in bill language and work through some of the conversation in terms of the actual language in proposed legislative concepts. I think it's also helpful to work with state agencies on cost projections in terms of like how we see the outcome of particular bills that might have a fiscal impact, to work with state agencies and teams to kind of just go through the cost mechanics and go through projections because that information is really helpful when engaging with legislative members or legislative fiscal office, or even just answering questions from DASC, because we engage with the fiscal analysts at DASC too. And then finally, some of the policy direction and some of the cost projections helps inform implementation planning in terms of timelines. Is a bill implemented immediately following the end of session, or is implementation planning 6 months out or a few years? Some of these basic questions, it's really important, I think, to just engage with the agency on the front end, because it helps really put some of these conversations in, improves the likelihood of success when these conversations happen during session. And I think we go to the next slide. And over the course of the rest of sort of summer, fall, we plan to have a variety of events across the state. We won't necessarily make the entire state, but we plan to go across a few districts across the state and connect with partners, connect with staff, connect with legislators. And some of this work will hopefully begin later this summer. But if there's other opportunities where people want to connect at some of these events as we continue to plan this out, we developed an email link for people to engage with the community engagement team and eventually engage with people across different teams across the agency. We also have a webpage for community engagement, and just overall, the goal is to continue to share updates across the agency around some of the work that we're doing collectively with each of you across the state. Next slide, please. And I'll go back to our moderators.
Thanks so much, Roberto. Before we get started on questions and answers, and we know that some of you put a few of them there in the question and answer box at the bottom of the screen, just wanted to emphasize that this one email contact that was created was as a direct response of what we were told by you that you, community partners, community leaders, faith-based organizations wanted an easy way to connect with ODHS. And so this one email actually goes directly to our community engagement team, and we'll be monitoring it. We know we have nearly 10,000 employees statewide, and this will allow us to do that work for you, taking the navigation burden off of you and putting it on us, which is where it honestly belongs. It's not for case management, but it is for community partners. So I'll go ahead and put that in the chat again, and I'll turn it back over to, I believe Lisa is fielding questions.
Yes, hi everyone. It's Lisa Morawski. I'm the communications director at ODHS. I use she, her pronouns. And we are going to answer some of the questions in the Q&A. So the first one, Fair Boards, you had referenced this earlier, but it's about how folks in rural Southern Oregon can access resources. It says many of the resources only go to the part of the state north of Eugene.
Thank you, Lisa. I appreciate that question. Naturally, the services that we provide and the funding that we provide, for example, temporary assistance to needy families, food assistance, let's say help with job placement, etc. Those services will be provided anywhere in the state. There is no limitation of providing TANF, Temporary Assistance to Needy Families, SNAP, Supplemental Nutrition Assistance Program, what used to be called food stamp, etc., regardless of where you reside in Oregon. I completely understand that as we look across Oregon, resources, tax revenue is basically in population areas. We're looking at the Portland area, the Tri-Counties, we're looking at the I-5 corridor, etc. We often hear that, and I think the governor, as she's going across Oregon, she's connecting with local community leaders, with various counties, and she's hearing that loud and clear. That's a strategy that the state legislature and the governor will work together to make sure that resources, perhaps new business, etc., as they come into Oregon, can be placed outside of the population centers. I can share with you one quick example as well as to how we tried to address that. And this was prior to COVID, when we stood up our one eligibility system. We had about 500 people that were managing a call center here in Salem, Oregon. And we basically went to what we call the virtual eligibility centers, and we distributed those positions across Oregon in rural areas. I remember going to Tillamook, Oregon, where 40 people were hired from that local community to support that virtual eligibility center. And we basically distributed those jobs through Oregon. These are living wage jobs. Unfortunately, I think some of those people still live in those communities, but in this world of remote work, that equation doesn't apply anymore, because people can live anywhere. And those people who have the option of working remotely, they don't necessarily need to live in rural or urban communities, but it also has benefited some of the rural communities where people don't like to live, with traffic in population areas, etc. So again, as it relates to Oregon Department of Human Services, the services and support that we provide is equally applicable to any area in Oregon, but I do appreciate that question.
Thanks, Fair Boards. Another question, this is about the new agency request budget process. It says the new process seems to devalue the agency's feedback on their own programs. How is this new budget process being received within the agencies? I think Fair Boards can speak to that. Yeah.
Can you repeat that first part of the question?
Sure. The new process seems to devalue the agency's feedback on their own programs. How is the new budget process being received within the agencies?
It's a great question. I don't necessarily frame it as devaluing our input. we all ultimately report to the governor, and we follow her priorities. And I completely agree with her priorities that are broader than just those things that come to mind. When you talk about housing, we might say that that does not necessarily directly impact Oregon Department of Human Services. In reality, when we look at the population that we serve, specifically in child welfare, self-sufficiency, even in the aging adults, housing is a big issue in Oregon. If that issue can be addressed, our job would be made much easier. If behavioral health issues can be addressed, our job in child welfare, in helping adults, can be made much easier. The other priority that she has in actually improving effectiveness and efficiency in the state government, as I said, we are all struggling for capacity. And if you have capacity, then we can do a better job serving people. That's one. The second piece of that, the response to that question, is that it is not only the governor. The governor actually plays a role in developing the state budget. It's ultimately the state legislature and the Ways and Means Committee that ultimately decides how investment is made in Oregon agencies, in programs, in communities. And those are representatives that come from all of your communities. So you have the power to bring forward. We have limited number of policy option packages and legislative concepts, but you have infinite number of those. In fact, most of the bills and the concepts that come forward come from communities. So please use those and utilize those. If you see gaps in the agency, if you see that you're advocating for people with developmental and intellectual disabilities and you see a gap, please take those to your representatives and senators and let those things move forward, because that's how most of the budget gets funded.
Thank you. Another kind of related question, Fair Boers, and I think you've touched on this a little bit, but maybe there's some more specific. Can you describe how ODHS plans to support the governor's housing priorities and how that work will complement efforts at the local level?
Again, great question. On a couple of different fronts. Some of you may have heard about the expanded 1115 waiver, which is a historic opportunity for Oregon, about $1 billion worth of federal assistance coming into Oregon. And things like housing and food are now being perceived and treated as basically core health elements. Those are basically could be medicine. Perceived or considered as medicine. We're involved in that because we sit around the table with Oregon Health Authority, with Housing and Community Services, to make sure that we are actually implementing that waiver as it gets going next year, to make sure that those services are being afforded to Oregonians. As I said earlier, many of our population that we serve suffer from housing issues. We've seen the availability of housing, the price of housing going up, rents skyrocketing in Oregon, and that has the impact on the most vulnerable and marginalized populations. That's generally the population that we and Oregon Health Authority serve together. As it relates to our responsibility for housing, it's limited. Oregon Housing and Community Services is in charge of distributing the funds, millions, hundreds of millions of dollars to local housing authorities that then are in charge of providing those housing services at the local communities. What we do, again, is very limited temporary housing. We provide vouchers to our youth that are transitioning to adulthood, to perhaps some families that need temporary assistance to get some shelter and housing. But as it relates to permanent housing, that's not an area of our responsibility. We are very attached with Oregon Housing and Community Services, again, because many of our people that we serve use those services, but we don't directly provide those services. So you may not see our direct impact in local communities, except again, those vouchers that are provided But we do collaborate with Housing and Community Services and with the Governor's Housing Initiative. I actually sit on the Interagency Council on Housing that includes several different state agencies, including Oregon Health Authority and Oregon Housing and Community Services, to contribute to the strategies around improving the housing situation in Oregon and then measuring how those strategies are actually making a difference.
Thank you. Another question about one of the governor priorities, with a focus on behavioral health. Will there be more funding set aside for older adults in addition to DD specific services?
That's a great question, and I don't have those that information in front of me right now. But I do know that behavioral health is an issue for older adults as well. And again, I know many of you out there are advocating for aging people, which includes me. So please, when you see the gaps, and if you see the gaps, bring those forward, because I think mental and behavioral health is not limited to one population, whether it's children or some other population. I think it can impact anyone and everyone, and we need that that funding to be available to a variety of different people.
Right, thank you. Let's see, we'll go to a different topic here. It's known that we have extreme housing. Oops, I just lost. Okay, sorry. It's known that we have extreme housing issues. What I don't see is talk about workforce services. People cannot remain housed long-term without employment. Any information on funding for workforce services?
Again, a very insightful question. As we talk about building well-being, we are really talking about those holistic services that need to be provided to people, including food, housing, medicine, education, transportation, etc., so that people can function. You can pull one of those two of those things out, and the person can still not get to permanency because they need all of those services. So one of the things that we are doing naturally in our self-sufficiency program, we have job placement services. In our vocational rehabilitation program, we work with job creators. We work with community colleges to basically partner in providing the type of skills and training that's required so people can get the jobs that they need, living wage jobs, etc. But we are also really trying to reset our understanding of how the world has changed after COVID. Both remote work and this whole environment that was created to where people had many more opportunities to perhaps work overseas, work remotely from different areas, has made it really difficult for the agency to hire and retain people in health-related areas. So we really do need a big push and job ahead of us to try to encourage people to go into those fields. Our self-sufficiency programs, again, I just saw their performance measure and performance chart for employment services. We can do better. It wasn't one of their best measures. And again, they're also struggling with finding the right jobs and basically referring people to the right jobs. Though, again, we have a very strong connection with community colleges that are that training ground for providing those basic skills that people need to get into jobs that pay enough to sustain people. So lots of work to be done, but it's a major area that we are focused on, and thank you for bringing that up. And naturally, we're also very connected with our partners in the Oregon Employment Department and also with the agency that oversees the community colleges, because workforce is a major initiative for community colleges. So those are what we're working on right now. And hopefully at one of the next meetings, we can report on where we're going as far as how we are making progress on those fronts.
Thank you. So there's a couple questions about education, another governor priority. So I thought maybe you could touch on that a little bit, Fairbores. How does the governor's priority for education impact ODHS? Is that priority limited to K-12, higher education, trade school? Another one, what impact will the K through 12 education budget crisis have on the upcoming session relative to revenue resources for ODHS?
Well, naturally, when you look at the state budget, when you look at education and human services, and when I talk about human services, it really includes health and human services. You might remember we were part of one agency, even though we're part of two agencies, the human services budget includes both of us. That's basically the majority of the state budget. So any movement in any part of those impacts the rest of the state. What I would say, though, is that education is a foundational element of success, but not the only one. We can do better as far as graduation rates for kids in foster care. The latest numbers that I've seen is between 50 and 60%, and we really need to be around 80%, 85% or higher. So we are doing some work on that front. But I would also say that you can be reading well in the 3rd grade. You can really have complete command of math by 9th grade, and you may still not succeed because the home environment, because the environment that you're living in is not such that can allow for your progress and for your successful entry into adulthood. And that's really where this vision of well-being is so critical and foundational to the work that we do. So education has to be put in the context of the other services that surround those things. I know that we also have staff in our self-sufficiency programs that work very closely with schools, because we want to make sure that those families are supported. Teachers are one of the first to actually know the challenges that students face when they come to school. If they're falling asleep, if they have marks on their faces, we get a lot of reports from our teachers so that we can keep eyes on our children, on children in Oregon, to make sure that they're not being abused, they're not being neglected, they have enough food to eat, etc. So there are many points of connections between ODHS and Oregon Department of Education, the school system across the state, and it takes all of us working together to make sure that the child not only does well in school and can graduate, but also can actually have a successful transition to adulthood, so that they don't end up in other systems, such as the juvenile justice system or the adult correction systems. Have one of the biggest issues that we have in Oregon today, and I assume there may be a question about that, is really substance use. Many of our youth are suffering from that challenge. And I think, again, we need to put a lot of focus on that, because you can do really well in school, but if you fall into addiction, all of that, it will never be wasted. Education will never be wasted, but that transition to success can take a whole lot longer.
Great, thank you. Fairbores, I'm going to give you a break for a second, and I'm going to give a question to Seth. And let me find it here. So budget priorities can be resolved with different strategies. As has been acknowledged, nonprofit service providers struggle paying a living wage, which creates a backlog that is felt at ODHS. So it is one thing to say you want to improve service delivery, but what is the strategy to do it?
Yeah, I'm hoping my mic's working better now than it was a few minutes ago. I apologize for that. So that's a great question, and it's really a high priority for us. We have developed a couple of processes in order to better engage with those who we contract with, community boost organizations, nonprofits. this team, the community engagement team, has put out some capacity grants over the last 2 biennia. So hopefully those are helping build the infrastructure to make it easier to contract with us. And we started a procurement council that really is about looking at all the issues around contracting with us, including costs, and we're everything from wages to insurance to ease of getting the agreements in place, to the legal costs. So when we're inviting community members that are potential contractors with us, or community-based organizations that are to be part of that procurement council. So please do reach out if you're interested in that. We're also partnering with the Nonprofit Association of Oregon. We just had a session with them where our administrator for contracts and procurement and I went and spoke about some of our initiatives and took questions and had some dialogue. So we're really trying to tackle that on multiple fronts, and hope to see some progress coming. So thanks for the great question.
Thank you. And I think we have time just for one more question. And we may need to do some follow-up on this one, but it's about home care positions. So will there be an increase of filling home care positions for people with disabilities? It seems filling the state job is much slower than private home care agencies, although state home care positions are also available. So I don't know, Fair Board, if you can speak to just any of the efforts underway on that workforce.
Thanks, Lisa. Again, good question. And I'm sure that many of the people who are in this call have family members, parents, grandparents, etc., that have that need and are having trouble finding people to help them. One of the benefits that Oregon has, they've been in the forefront trying to keep people out of long-term care facilities, out of institutions, out of congregate care facilities, to make sure that if it is possible for them to have their services provided at home, in-home. So one of the challenges that we face, again, is the current economy. Today, it is much easier to go to work for even a fast food restaurant and make very close, or maybe even a little more than what you're going to make working as a home care worker, as a personal support worker, etc., and even get a bonus, a startup bonus, etc. And generally, the people who work in that profession are very caring. We are working closely through the Home Care Commission to make sure that we have the right strategies in place. And again, I'll be very honest with you, we're trying to figure this environment out. I don't think, whether it is the private sector or the public sector, we still have not totally defined what this post-COVID environment look like. People are having different priorities. People are choosing different professions. We have seen a major exodus of professionals from health industry. We are also seeing that in the care industry, caring for people, whether it is caring for people in home or in nursing facilities, in adult foster homes, etc. So there are new strategies that are required to recruit and retain employees in those environments. And at the same time, most likely, we have to look very closely to wages and see how they compare to where the economy is going, where the private sector is going, where some of the competition is paying. And as you know, the state system is not robust enough to, we work on biennial basis. We get our budget in the beginning of the biennium. And unless something happens, there is additional funding in the middle of the biennium. Sometimes our system is not quick enough to respond as quickly as we all would like to see it to address some of those challenges. Seth talked about, answered the question about nonprofit organizations and the difficulty that they're having to basically just keep afloat. We are aware of that. We're working on it. And frankly, one of our biggest challenges is how do we match the needs that exist in Oregon, at least from the standpoint of the population that we serve, and how does that then match up with the available revenue? We've been very fortunate up to this point. Every revenue forecast has been up, but this last revenue forecast, you might remember, it was up by $500 million, but that basically just filled the hole. We are not going to have $500 more million in the next biennium. It just covered a gap that existed. So again, we're keeping our fingers crossed that economy continues at a robust pace of tax generation so that next few revenues forecasts are positive, and that can help address some of these issues. But again, we are very closely watching the August revenue forecast. And again, thank you for that question.
Thank you. So I'm going to pass it back to Stephanie to wrap us up.
Thank you. And thank you so much to Director Fairbours for staying on and answering all these questions. And also to the many folks who were on the back end also working to answer these questions. We know we have 25 that we answered either in writing or verbally. We also have another 14 that are open. So we just want to remind you that there is a community partners page where we're going to be seeking out all the answers to the questions that you have and posting them. Really, really appreciative of the leaders that you don't see here in this room, but are on the back end trying to get questions answered. And then we do want to tee up the fact that from July through November, we are coming to, hopefully, a city near you, ODHS leadership, where we want to be able to meet in person, if possible, and hear more and discuss more and get more input into our agency request budget or the governor's budget and continue the conversation. Also, as a reminder, in the chat, you'll find our community partners email. We are happy to start directing folks to the right place. We know it's very difficult sometimes to manage this incredible organization. And we have one more thing that we need from you, which is at the end of this meeting, you'll see a little pop-up. It's not a survey, it's actually a contact form. It's an interest form where if you're interested in meeting with our leadership as we're starting to go out and tour Oregon, that we would ask you to express your interests. And also, are there specific things you'd like to discuss with our leadership? So we hope that before you log off today, or as that comes up, you'll go ahead and answer that so that we can keep you informed and keep this conversation going. Anything else for the good of the order, my friends at ODHS?
Thank you so much for joining us. Really appreciate you all. We are in service to you and look forward to our next Comfort Together next quarter, if not before. We'll hopefully see you in community meetings as we make our trips across Oregon.